The St. Joseph's Children's Hospital Foundation's annual Heroes Ball is quickly approaching. And this year, the goal of the Heroes Ball is to raise $2 million to fund 5 additional nurse navigators at the hospital for the next 5 years. Joining us to talk about the Nurse Navigator program and the ball, Natalie Jackson, a nurse navigator with St. Joseph's Children's Hospital herself, and Sam Ellison, who's going to be co-chairing this year's ball. Welcome to the show. I'm so glad to talk about this. I've been at the Heroes Ball before. It is just so incredible. But I want to learn more about this nurse navigating program. What is this all about? How do you help the children and their families at St. Joseph's?
So nurse navigators are like a patient advocate and a bridge between the patients and their providers all in one. Your child has been given a diagnosis that is going to affect them for a short time or a long time, and we are there to help them understand their diagnosis, educate them on what's coming next, really get to feel like they are experts in their child and know that they are fully equipped and capable to take care of them when they go home.
Again, things you don't necessarily think of unless you are in that situation. And the Heroes Ball, one way to bring a spotlight and of course bring funds. Talk about what the Heroes Ball is and why this year this is a way you want to make sure and give back to St. Joe's.
Well, my son and I are co-chairing it. His name's Casey Ellison. And the personal experience that Casey and I have with the hospital was my granddaughter was born at St. Joseph's Women's Hospital and had complications. Had to stay there for about a week and a half. And I was super impressed with the way the nurses and doctors genuinely cared about my granddaughter. So that's why I'm involved.
That is so moving. And again, it's one of those times things you don't necessarily think of until you were in a situation like you and your family. And right now you were saying too, St. Joe has 4. We want to increase that number. Talk about the 4 now and then being able to see the challenges that were faced and why increasing it with what is able to be raised by the ball, how it's really going to help.
So the 4 we have now are covering our cardiac kids and oncology. So we are really blessed to have had 3 already established in the cardiac program and 1 with oncology. But there are areas like the aerodigestive team, neurology, rheumatology, endocrinology, and the neonatal children over at Women's that are all going to benefit from this.
And of course, being able to benefit, it's one of those things, again, I keep saying you don't know until you actually need the situation. Talk about being able to navigate, especially with little ones like your grandchild right when she was born. I mean, so many emotions and stress parents are already going through. I'm assuming you hear that daily when you're able to help these families.
Yeah, I think the real relief on their face is when we know we're doing our job well, when they realize that things that they have been concerned about that kept them up the night before are handled, and then they can just focus on the care of their child and them getting better and getting home because we've helped handle the rest of it, and then it's all planned out for them.
Okay, so what do we need to do, Sam? What do we need to do to get involved and learn more so we can attend the Heroes Ball and be able to help?
Well, we have a great lineup of entertainment. It's always a blast. I don't know how many people have been there before, but if you haven't been there, you're missing a great experience.
You know what? There we go. Couldn't have said it better myself. There's the information right now, the website, so you can make sure and get your tickets for the 2025 Heroes Ball. Thank you to the both of you.
Thank you so much.
Thank you.